joint seminar today. We're really excited to be sharing the space with our Personal Outcomes Network colleagues, and we hope that you get lots out of our seminar today. I'm not going to spend too much time at the beginning because I think what we need to do is get into our wonderful programme. So I'm just going to pass across to Emma to get us started, but just to say thank you once again for your time, and it's fabulous to have everybody in this very positive learning space today. Thanks, Emma.
Thanks very much, Donna. I'm actually handing to Ashley from the pond to do the intro first.
Thanks, Emma, and also thank you very much, Donna, and to this community practice for hosting the PON for today. It's been the first time that we've been able to come together since March due to essentially funding issues. So we're really grateful to have the space to come together and restart the conversation this time around. So we're just going to start the day with a few presentations. We're a wee bit pushed for time, so I'm probably just going to jump straight into bringing in our speakers, but we'll first hear a bit from Emma Miller just around the personal outcomes approach and just touching on some of the conversations that we were having back in our last event back in March. We'll then pass over to Donna again, who will tell us a wee bit around Social Work Scotland's connections with the personal outcomes approach. And then finally, we'll be hearing from Jean McQueen, who is the Principal Educator for Person-Centred Practice from NES, who will be telling us a bit about work that she's been doing with the Alliance on person-centred approaches to health and care, and what matters to me. So on that note, oh, and actually one final thing is just so we can get a wee bit of a sense of people's experience with the personal outcomes approach, if you can maybe just pop in the chat if you are a pod member or if you've had that kind of experience with it before, that would be great for when we come to do our breakout rooms later and just getting a sense of what people already know. So on that note, I'm going to hand over to Emma.
Thanks very much, Ashley, and I'm hoping the slides will magically appear on the screen any second, courtesy of Social Work Scotland. But just to kind of set the scene, I'm going to do the slides karaoke style, be really strict with myself about sticking to time. But the slides are a repetition from our last workshop, which was in Edinburgh back in March, and the title of that workshop was Chinks of Light in Challenging Times, where I think we're still in that same space of challenging times and thinking about, you know, how can we collectively pool our resources to find ways forward through the challenges. And I guess the background to the presentation was that we had been collaborating with colleagues working on different person-centred approaches. And I think we would all agree that it's really important that we do that. It's essential to collaborate and find common purpose through challenging times. But I think as well, sometimes what can happen is when you're putting different approaches together, that you can risk dilution of the different approaches. So there's something about working out what's the same to make it easier to embed different types of person-centred approach, but also being clear that we don't lose the specific contributions of different approaches. So if we move on to the next slide, please, Callum. So we had been looking at the different person-centred approaches early on in the year, and lots of different person-centred approaches out there. There's no common definition for a person-centred approach, but that makes sense because it covers an umbrella of very different types, which have come from different places and are sometimes quite context dependent. So I think the fact that there's different definitions, we can live with that. Also, just to acknowledge that the language can cause tensions. People can get quite upset if we're not kind of using the right language, you know, whether it's patient-centred, person-centred, or now even moving into more person-led language. And then you've got person-centred care or planning or approaches, service development. And I guess what we were trying to do is say, let's not worry too much about the language that different people are using. Can we get to sort of common understanding of what the core principles are? So I think there is a sense out there just now of things being a bit overwhelming. Anything we can do to make it easier to embed these different approaches, or to say, here's some of the core common elements, if we can get those right, then, you know, you've got the basis of lots of different approaches in place. So if we move on to the next slide, please, Callum. And what happened was, as we were doing the workshop, we looked at what's out there, what resources are there, and we discovered a Scottish Government resource that was produced in the context of COVID recovery. It was about learning from person-centred approaches. And what was interesting in that resource was that they came up with 4 key elements of different person-centred approaches. And the 4 key elements were that they were all holistic, looking at the whole person, that they were ethical, sticking to ethical principles about genuine engagement, that they were asset-based, so not just focusing on deficits, but what are the strengths and capabilities people bring, and that they were all relational. So I think there are 4 common principles to all of them, and that kind of gives me a bit of reassurance that there are those common principles. So if we move to the next slide, Callum. And just to kind of touch back similarities with work we had done before, again, looking at slightly different person-centred approaches, but we kind of, this was back in 2018 for SSSC, we had done a similar exercise. And what we found was that, in essence, I'm not going to go through them. The point of this slide is that we had already done a similar exercise to the Scottish Government one last year, and we came up with the same principles using slightly different language. So let's take that as read, that these core principles stick across all the approaches. So if we move on to the next slide, please, Callum. And I guess, so coming back to that bit about there's core common principles, but what are the distinct elements of the different approaches? And of course, from our perspective, we want to look at what's unique about a personal outcomes approach. And it was quite helpful to think about that actually for the first time. So I guess some of it's about, with personal outcomes, some of those factors are more explicit. So with personal outcomes approach, it's more explicitly about the whole person, because you have those diverse quality of life outcomes and also change outcomes, which are about recovery and managing symptoms, etc. So that holism is actually baked in. I guess as well with the outcomes approach, there's that bit about the outcomes need to be personalised. It is a personal outcomes approach. That means that there's some challenges with measurement. But as we know, if we move away from the concept of measurement to tracking outcomes, then it is possible to build a picture of outcomes over time. Another key element is around what matters to you in the context of your life. So some person-centred approaches are very much within the context of the service. What matters to you when you use our service, but a personal outcomes approach is what's important to you in your life. There's also the focus on process outcomes, which does kind of relate more to some of those person-centred approaches. So things like being listened to, respected and valued, the relational elements are part of a personal outcomes approach. And I guess another thing is that, and this is common to some other approaches as well, it's a whole systems approach. It's not just about what practitioners do, it's about supporting practitioners, what needs to be in place to support practitioners to practice in that way. I guess with the personal outcomes approach as well, there's the exchange model. So that puts emphasis on everyone's contribution. And in fact, although the person's voice must be in there, the outcomes are negotiated. Sometimes the carer perspective is in there too, also the practitioner. And I guess where that really crystallises in our recording criteria. So the recording criteria come from the Meaningful and Measurable project, and there are 5 of them. They mean that it's about outcomes, not just outputs. What matters, what's the purpose, not just what is it we're putting in. That the outcomes should be personalised, as I've already said. That the person's voice should be in the record. What is it they're actually saying? Can we hear a few words that they've said to bring that person to life? And then it's about the role that the person or family is playing. It's not just what's being done to them. And then that it also should be action oriented. Those are the recording criteria. And finally, just to move to the last slide, and I'm pushing over my time here, so I'm going to try and do this last slide in one sentence, which is slightly moving to the side. What we were trying to bring into that workshop in March was a sense of hope. And in essence, referring to a project from earlier, I think there's a link there if people are interested later. What's interesting about hope is that hope, the main hope theory is Snyder, and Snyder's theory of hope is about goal setting. So it's about defining what are the goals towards your Imagine Better Future, and what are the pathways to achieving those goals. That's the core hope theory, and if you look at hope literature, you will see Snyder reference. So that very much brings us back into the importance of understanding outcomes. And I'm now going to stop and hand over to Donna. Thank you. Poor Callum having to work at such speed.
I
don't think we've got
Sorry,
Donna.
Callum, are you all right?
Yes,
Pardon?
I'm all right. Oh, there we go. Fantastic. Great to hear you, Donna.
Can you hear me now? Is that okay? Not sure if you can hear me. Yes, and you've got the slides there, Callum. Thank you.
Yeah, here we go.
Brilliant, thanks a lot. So yeah, it was just really to sort of quickly go through ways that we are supporting a personal outcomes approach within self-directed support. And as I said, I know from the personal outcomes network evaluation and our COP members that feedback, we share many of the same hopes, practices and challenges around better outcomes for people. And these are great shared spaces to collaborate. So very briefly, there are a number of practice resources, networks and tools which we would love to share and which we will be hopeful to help colleagues in the room today. I'm not going to go through them all, but we'll provide links. And of course, this seminar is recorded and will be hosted on the Self-Directed Support Library, where you can find all the other useful resources. So very quickly, our toolkit was written by social work practitioners and others and SDS stakeholders and people with lived experience, and focused on key areas where social workers told us that practice is tricky and where supported people and carers told us things weren't working. So things like early help and support, assessment, the 4 options, reviews and challenging decisions. And within the toolkit, we have a section on personal outcomes, links to the personal outcomes network, and a real description of the post of a personal outcomes approach. We've also got a key set of messages in the toolkit, which is around what self-directed support is, and that is understood by not only social workers and other practitioners, but by everybody, what we mean by self-directed support. There's also a section on the current landscape and links to legislation, which we know, again, we've talked about the alignment with strategic national policies. So our standards, let me just go through to the standards. Thanks, Callum. We're delighted to share our revised self-directed support framework standards and our easy read version that's been approved by Scottish Government and COSLA. And the standards are for all people and describe what good self-directed support social care looks like from the perspective of the person, whether that's children and families, young people, carers or families, and what the authority needs to do in relation to that. The framework's been designed to align with the self-directed support statutory guidance and support wider implementation. Our lovely wheel, the standards wheel, practitioners told us they want practice resources which are accessible and well designed and interactive. And here we have our lovely colourful standards wheel that you can click on any particular colour and standard, and that will take you through. And we talk about personal outcomes in a number of our standards. Our standard 3 on strength and asset-based assessment, planning and review, where we talk about what matters, the use of community supports, the importance of relationships, and using reviews to ensure that people continue to achieve their personal outcomes. Our standard 4 about meaningful and measurable recording, where we talk about recording, capturing the narrative of the person's story and the quality of the conversation. And an ask that leaders ensure that what matters to people is recorded and progress towards achievement of personal outcomes is recorded. And then our standard 7, flexible and outcome focused commissioning. We talk about trusting relationships and people's voices being heard in the design of their own support. And finally, our standard 12, where we talk about people being having flexibility around how they can spend their budget to meet their agreed personal outcomes. So our standards look a bit like this, where the person on the left in blue is the supported person, the child or the young person or the family, and they're saying what they expect. And then the person in the pink, which is you, the worker, responding to the conversation and in a relationship with that child, young person or older person, and responding on behalf of the organisation, helping you to get your outcomes. We also have just recently our self-directed support learning and improvement framework, and that's really a tool to use starting where you're at and looking at where you want to go in terms of achieving the standards. And all of these are together in the self-directed support library, where many of our seminars are also, because we record them. We also support the national collaboration which provides a platform for people with lived experience and informs all our work and provides that opportunity to amplify to Scottish Government what matters to people using services and supports and what matters to people working in social care and social work. Again, we can provide details to join. So finally, thank you very, very much. We love learning what works for people and how good practice can be implemented well and how we can fill social care and social work with hope and investment and enable it to be the real springboard to opportunity for people to achieve all their outcomes. So thank you very much, Emma, and I hope I've not got over time. Thanks, Ashley.
And I think we're now handing over to Jean.
Thank you. I will just try and share my slides. If people could give me a little thumbs up if you can see these when they appear on your screen, then I'll know that I've actually shared them correctly. Thank you. Thank you. Okay, thank you so much for the opportunity to chat today. I'm going to post a little bit in the chat because I'd like you to think about some questions as I'm going through this this morning. It won't take too much of your time. We've had the pleasure of working with Alliance, who have been asking people who use services what a person-centred approach means to them. So I'm delighted to share with you some of the information that we gain through part of this piece of work and also our next steps. So what I would like to share with you is going to form an animation which will welcome learners to the Person-Centred Care Zone on TURAS. We're in the process of refreshing and developing our TURAS Learn resources, and you're actually the first group that we've shared this with, so we're really curious to hear your feedback. So I'm going to read it as if it comes from the narration that will go with the animation once it's completed, and the infographic. So the work was taken place, involved people in focus groups, in interviews, and in a consensus event where people voted on what they felt a person-centred care approach meant to them. So here is what they told us, that everyone receiving health and social care in Scotland has the right to be treated with dignity and respect. And for them, a person-centred approach demonstrates that we care and encourages people to be active partners in their decisions. So I hope it mirrors what Donna and Emma were saying early on, which is really good to hear. And it's about delivering care in a way that makes people feel engaged, empowered, safe and secure. And when care and treatment doesn't take a person-centred approach, the people told us it can lead to frustration, lack of engagement and mistrust. And when we fail to listen and involve people in decisions, they can feel dismissed, helpless, and this has a negative impact on how well people engage with our services and their overall health and well-being. The person-centred approach means seeing the whole person, and the animation will zoom in to different parts on this slide. It places people and their families at the heart of decision making. It's about collaboration and finding out what matters to people and their families. This means showing kindness and compassion. It's about tailoring what you offer to their unique needs, preferences and values. And it's about working together, asking about what matters, developing treatment options and solutions collaboratively. And when we do this well, people will feel empowered, safe, engaged in their care and treatment. And the individuals and the focus groups told us that when we are kind and we listen to understand and we collaborate and show respect for cultural awareness, the benefits, well, they can be huge. People's health and well-being needs are met and their human rights are upheld. And in turn, as people providing care, we benefit from a boost in the feel-good hormones and from the satisfaction that we know we have made a difference to someone's life. And when we see the bigger picture, our services should be driven by equal partnership, personal preferences, and they should be values-based and see people as individuals. When we see this bigger picture, everyone benefits from high quality health and social care where people feel engaged, empowered, safe and secure. And so the resource that we're talking about was developed with Alliance and Healthcare NHS Education for Scotland. And we're very grateful for the contributions that the people who use our services had made to develop this. And we're interested to hear your thoughts. It's been a very, very short whistle-stop run through of this resource because I know that we're really pushed for time, but I'd love to hear your thoughts on how this landed with you in terms of the language, the terminology. What do you think? Does it fit for your sector? And would it be useful in your area of work? So I'm going to stop sharing because I know we need to move to breakout rooms soon. But if you could put your answers in the chat, or that would be really valuable because I don't think we have a lot of time for discussion, unfortunately.
Perfect. Thanks very much, Jean. And we're not too far over time, so we're doing quite well. But as we said, we're going to go into breakout rooms now. And yes, it's been a little bit of a whistle stop with information given today, but breakouts will hopefully be an opportunity for you to reflect on what you've heard, give us some of that feedback, or alternatively, like Jean says, post it into the chat if you can, so that you can see it there. But in coming into these breakout rooms, just let us know what you think about the approaches you've heard. And for us in the pond, what would be really useful is hearing a bit about the opportunities and challenges to these approaches. And equally, what are your priorities for going forward in terms of the support that the Personal Outcomes Network could be offering over the course of the next year with our kind of limited resources around funding and such.
Welcome back, everybody. I'm Helen McFarlane. I'm another member of the Personal Outcome Group. So Ashley had asked me whether I would lead on getting a bit of feedback from the discussions that went on. It's really hard to do this, but what we're going to do is combine it with a form that Ashley will put in the chat, or two forms actually that Ashley will put in the chat. One is an opportunity if you've got a story or some work that you're doing around personal outcomes that you would like to share. We've created like just a wee MS form that you could complete that information, and then we'll use that information to share on our website. So we're asking you for your contact details so we can go back, but they'll be anonymized or whatever, the stories that go up onto the Personal Outcomes Network. So if you've got a particular story of something that you're doing or something that's going well, and you'd like to share that information more widely, then please use that form that Ash has just put in. And on a just individual reflection point of view, the other form that Ash is going to post is the head, heart, bin, kind of feedback form. So we want to know what's, what have you felt about today? What is there an idea that you're going to take away with you? Is there something you just want to leave behind, put in the bin, or what have you? So that will go into the chat as well, just to give us some feedback on what else you might want from the Personal Outcome Network meetings going forward. But let's go around and get some feedback from the discussions that you've had as well. So we've not really got group names, have we? But I go to, if we start with my group, because I know that's Laura that's going to be giving us a little bit of a flavour of the discussions that took part in the group that I was part of. Laura?
Thanks, Helen. I think that overall our group found the animation very positive, and that message of getting back to basics, and supporting people to understand that personal outcomes approach. And some of the what is already happening was we had some examples of when we're writing notes or records or reports, just thinking about how you write that and whether or not that's written in the first person. as opposed to the third person. When thinking about learning and development of staff, then, you know, someone described how they have practical sessions where they would try the resources out with each other first, in order to sort of build that confidence and the knowledge and skills to be able to then deliver that in their practice. So in terms of that message around self-management and moving away from deficit and keeping well and living well, then what support did we need around that? What else can we do? So we talked about that not all staff can attend formal training, and so, you know, what can we do to support that in terms of the resources? Also in terms of those that do attend any sort of formal training or learning opportunities, then how do we support them to embed that into their practice, but also to share that learning across, you know, with others? And some suggested things were around having ongoing huddles, and again those practical sessions of practicing and trying things out together as teams and groups. Perhaps there might be a focus on management in terms of managers being involved in understanding this different way of working, or just being able to change that organisational culture around a personal outcomes approach. So in particular, what could the network help with? We were hoping to capture stories around some of the examples that we discussed within the group. We'll like the idea of the practical sessions and how that'd be such a good story to share. It was great to hear from about in the presentations earlier about the focus groups and finding out, you know, in terms of the public, what does a personal outcomes approach mean to you? Because perhaps we could build in some resources within the network around public expectations and messages, around the language that we use within the personal outcomes approach, and how we have that culture shift towards self-management as well. And I think that covers.
Well done, Laura.
Thank you.
It's always really tricky, isn't it, to try and capture the discussion of what's gone on, but that was brilliant. Thanks, Laura. Can I go to Emma's group next? I'm not sure whether it's Emma or somebody else in the group that will be feeding back.
Sure. I didn't ask for I wish I had asked for a volunteer because I was so busy scribbling notes at the same time, trying to listen. So I've got screeds of notes and it's really hard to pick out. I suppose anyone else from my group's welcome to come in behind me. But I guess my overall impression of the conversation was a sense of struggle just now with, again, the theme of communicating with the public. What do we mean by outcomes? How do we have that conversation? But also, a lot of people were talking about the clash between the aspirations, perhaps, of an ideal and the reality of the restrictions and especially eligibility criteria was mentioned. And how do we support practitioners to navigate that complexity? And I think some of there is some work already going on where about those honest conversations, or as one person's described it, I've forgotten the term, not challenging conversations, necessary conversations, using the word necessary conversations to kind of say, well, they are difficult conversations, we have to have them. How do we collectively have a consistent way of having those conversations that's honest but still allows people to have hopes and a sense of possible futures? And I think there's a lot that we could do around that. Those were some of the key themes. We also had shared with us a couple of examples of induction programs and some of the materials in there, and a reference to Kate Malcolm's work about, you know, navigating risks and organisational risks and stuff that we could draw on there. And yeah, from my notes, those are kind of some of the key things that jumped out. Does anyone else from my group want to come in with any of the other key themes?
Hi Emma, I would just wanted to add to that in terms of just getting a consistent approach and messaging over, which is really important to make sure we're involving our leaders in terms of any organisational leaders, and for decision making and the implementation, it needs to be a collective, it needs to be consistent. So probably that would be a big message in terms of consistency.
Important point, Rhonda. Thanks very much
Lovely.
for that.
Thanks very much, both of you, for feedback from that group. And again, see those two links that are in the chat. So the storytelling, it's not just about any individual stories of working directly with individuals. If anybody's got any stories of how they've had some success speaking to the managers and getting some systems change, please share those stories. Use that same one to share those same stories. It'd be really useful. So thanks, Rhonda, because I think that's what we're always looking for, isn't it? You know, has somebody cracked this? Has somebody had a breakthrough somewhere? And if so, would you share those stories, or in using that same form? Can I go to Donna's group, Donna/Lauren's group?
Thank you. Laura's going to feedback, but thanks to my group.
Hi folks. Yeah, so we started off talking about animation as well, the power of animation, and also I guess the potential real accessibility of that. We kind of thought about that as a potential communication tool for self-directed support, but that being a sort of, how would we create something national or what already exists? But that also led us on to hearing a little bit about Danielle Farrell's work, Dr. Danielle Farrell, who uses animation very creatively when she does planning, outcomes support planning for people that she works with. And she described that as offering a unique level of personalisation, because you can add your own music to it, you can add your own photos and imagery to it. And off the back of that, we thought maybe an interesting input for the PON in future times is to hear a little bit more about how Danielle goes about the work that she does. And then we kind of moved on to connect the sort of agenda of the Personal Outcomes Network also with all the things that are going on in the kind of What Matters movement, and how for people who are maybe newer to both these bits can kind of take the best of what's there, and can sort of move that into the work that they are doing. So the example here, I suppose, was for somebody who was working in the care home sector, how can they kind of get the best of what's available and offer that to the team, to colleagues, to the culture of where we're working, so that we're delivering and importantly collecting information about people's day-to-day experience, not just the sort of bigger questions about things like hospital, but actually are folk having a really good life when they're living there, and how materials from the PON and other places can benefit that and help that. And then we had a wee bit of an interesting discussion about, because I suppose there's some people who might be newer to this work, so actually what's the kind of historical stuff that might have happened in the network that might already be available? How can people go back and visit inputs that have maybe already been made around, and then there's been something very valuable about people from different sectors, different parts of the one big care sector coming together to share how you do it in your patch, or being able to recognise when other people are doing it in a similar situation. So that place to profile that information, how do you quickly find examples of people who are either doing that in a sector that you're interested in or doing it in your sector? How do you find that? Is that on the website? Is that getting access to that? Don't know if anybody from the group or Donna wants to add anything else.
I think that sounds brilliant, Laura. Thank you.
It does, sounds really great. And again, can I just encourage, some real good examples there that either can be shared again using that form that we've saved there, or if people are willing to do a presentation at a future PON network, that would be really, really useful just to have, because I think it's these things that people are just doing, oh, that wee little thing, oh, that's just something that we just do, but they're the little things that really help somebody else to kind of turn it from a thinking into a reality, isn't it? So anything along those lines, we'd be really keen to provide opportunities through obviously online seminars and things with the PON network to be able to showcase and share. So that just takes us to our last group, that's right, isn't it? Which is Ashley.
I think so. Thank you, Helen. I'm also doing that thing where I'm trying to go, right, what's the key things from the conversation? And if anybody from my group thinks I've missed anything, please jump in at the end. But we were talking about quite a lot around setting the right expectations, and just that, I guess at the minute, the reality on the ground is that we're quite far away from being where we want to be in terms of applying either personal outcomes approach or more general person-centred approaches. And that's for a variety of reasons, such as the challenges around financial constraints, recruitment and retention of staff, and also the problematic thing that we've had constantly around measurement. And also a lot of variation in terms of how staff perceive different changes that are made to try and make our services more person-centred. Here in one specific example of how eligibility criteria has been adopted and the assessment process slightly changed to incorporate people's feedback into that assessment. And that part's been especially challenging for staff to actually engage with. But what we also heard were some good stories from one person in particular, talking about how, despite the challenges of applying essentially person-centred approaches in practice, or good conversations in practice, what they have been able to do in amongst a restructure in their organisation has been apply that to the restructure process with staff. And in that way, kind of emulating that compassionate leadership, and that's what they're hoping to build from. And we heard that emulated again in the discussions around measurement and how to incorporate experience, and that staff experience needs to be heard alongside people's experience, as it's equally important in understanding what is actually going on. And again, we just got cut off before we came into the room, but we were starting to go into that managing expectations of people. Because right now, often in the system, it's really difficult to just give people the basic choices, never mind what we're talking about aspirationally in terms of personal outcomes approach. So some of those challenges, but some things that we can definitely work with going forward.
Great, thanks, Ashley, and thanks for that feedback. So there is this multi-layers, isn't it, of the kind of systems and the managers, support for ourselves, and just practical ideas to share for our practice, but also the public at large, and how can the PON network provide opportunities for that kind of material to share as well. Can I just direct you to those two forms in the chat again, please? At any level, any of those sharing stories, we'd really welcome. Please use that MS Forms to do so, and then your own personal reflections back. That kind of that feedback would be really helpful for us as well, in terms of any ideas that will help us in the planning when we get together again as the coordinating group, in the planning of contents for future webinars. So can we just, and your hosting, and how that's worked really well to come together from our point of view in terms of that kind of that shared agenda. So thanks for all the speakers who have contributed, and thanks for yourselves for all the contributions that took place as well. Thanks very much.